I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon, I'm an ear, nose, and throat surgeon, and I'm also a plastic surgeon. I'm the host and founder of the Direct Care Movement podcast, where we dive into the intricacies of direct care, whether it's direct primary care or direct surgical care. You can find out more about what this movement is and where it's going and where it came from. And I'm really excited today to have as our guest Dr. Mathew Abraham from Veritas Surgery. Dr. Abraham, thank you for joining us.
It's my pleasure. Thank you.
Awesome. Can you tell us a little bit about yourself and a little bit about Veritas?
Yeah, so I'm a general surgeon by training. I trained in Knoxville, Tennessee, and did critical care fellowship and worked for a couple of years for a hospital in the South doing trauma and critical care general surgery. But then I started hearing about the direct care movement, the Surgery Center of Oklahoma, and realized that there was potential to build something much greater and enduring, and not just a short time working for the same hospital as a contract laborer. So I left that job and moved out here in Idaho to start Veritas Surgery. So Veritas is a direct care provider. Basically, we are a group of surgeons that offer direct, transparent prices for surgery, and that's everything included in a single transparent bundle. So patients know exactly what they're getting into upfront before the procedure is even completed.
That's awesome. So in our current healthcare system, how much transparency do we have?
Oh, there's basically no transparency. It's ironic because there's so much talk about transparency, but that means that people have to say something up front. But it's hard to get them to actually stick to that, because if you get a good faith estimate and then the procedure changes, then the good faith estimate was only for what they quoted you for, and you can get billed whatever for what was actually done afterwards. And just because somebody has to give you a number doesn't mean it's a good number. So they can make up any number they want. And you can be told that your shoulder replacement, for example, will cost anywhere from $25,000 to $250,000. And there's no guarantee what the actual cost of doing that procedure is, or what you'll actually end up having to pay afterwards once you apply for all of the financial aid or hardship or whatever.
Right. Now, how does that differ from what you guys are doing at Veritas?
So with Veritas Surgery, we have our prices published on our website, and as soon as a patient contacts us, we give them a ballpark idea of what their surgery is going to cost. That's obviously dependent on actually talking to a surgeon and discussing the clinical appropriateness. But once the patient has met with a surgeon and there's a plan to do a specific procedure, say an inguinal hernia repair, we send them a detailed invoice showing exactly what that's going to cost them. If there's more than one surgery, if they're not sure if they need one side or both sides, we show that to them. But at the end of the day, the patient has a firm quote that tells them exactly what they're going to pay when the surgery is completed. And that's the only bill they're ever going to get. There's no additional bills for pathology, for crutches, durable medical equipment, or anything. Our one price covers all of the patient's care for that surgery.
That's awesome. That is really exciting. It's a lot different. I remember when my daughter was born, my youngest daughter, it was actually the first time that the military didn't pay for all that stuff. And we were getting bills for up to a year. And I was like, and I'm an insider, and I was looking at these bills. I'm like, what the heck is this?
I had a surgery performed by a surgeon outside of Veritas about a year ago, and I didn't even get my first bill from the hospital for about 9 months afterwards. There's so much uncertainty as a patient. From my experience and from talking to patients, often patients are reluctant to even start down the road of surgery because of the uncertainty. They don't know what bills they're going to get, when they're going to get them, how long that's going to go on. There's actually some studies looking at barriers to getting surgery done. About 50% of patients don't get a procedure that they've been told they need, largely because of financial concerns, because of anxiety about the bills, or because they know that they can't afford what it's going to cost. If you actually look at there's really good financial data showing that most patients are functionally uninsured because they can't afford their deductible, which means you can't get the surgeries that you need, or that the number one cause of bankruptcy in America right now is medical bankruptcy. So patients can't afford the care that they're getting. They are often avoiding the care that they need. And a lot of that is because they don't know what it's going to cost, or because the numbers they're being told are simply astronomical and unrealistic.
Okay, so it's great that you have transparent pricing. I'm going to play devil's advocate a little bit here, okay? But, I mean, if I'm Joe Schmo, person who needs a anal hernia repair. I'm like, okay, doc, that's awesome that you have transparent pricing. Now I know in advance that my hernia is going to cost $100,000.
But that's the beauty of it. By cutting out all of the red tape and unnecessary complexity, we actually end up with a far cheaper price than you can get almost anywhere else. Typically, the price that I quote my patients at Veritas Surgery is about 40 to 60% of the total price that they would get if they just went to any old hospital and tried to negotiate for themselves or just ask for a price out the door.
Sure. Now, okay, again, playing devil's advocate, right? Okay, so that's great, doc, that it costs 40 or 60%, but my insurance is going to cover all of that, isn't it?
That's kind of a complicated question. There are some situations where it is better. If you have insurance, you've already paid for that, and you have a reasonable deductible, often it's better to just go with that. I have had patients who have a high deductible plan, and once you factor in the patient's copay and deductible, the total cost of that, the total amount of that higher bill from the hospital that they are going to pay is actually more than the cost, all of the cost of my lower fee that they would pay. Just very roughly, if my hernia surgery costs $5,000, you have a $10,000 deductible plan and the hospital is going to bill you $25,000 for the hernia, you can see how pretty quickly it's actually cheaper to pay for my costs. Then you get into the question of whether you should run up your deductible anyway, because you don't know what will happen in later in the year. That's a little bit more complicated, but that's just for the insurance patient. For a lot of patients, our ideal audience are patients who don't have insurance, where obviously they're just stuck paying whatever cash price they can get. And I guarantee you my cash price is the best. Or they're sharing ministry members, where as a sharing ministry member, they're functionally a cash patient, and anything they can save directly benefits all of the other members. And then the biggest and fastest growing part of the market are actually the self-insured employers. So that's employers where the employer is paying all of the healthcare costs directly out of their own bottom line. And so for those employers, when the patient either is out, doesn't have a network, and so they're paying top dollar at the hospital, or they have a network that's put together by Blue Cross or one of the big BUCA carriers, but that price is not actually a competitive price because the insurance networks actually want those prices high so that they can make a profit off of it, basically. So for those self-insured employees, often it's much cheaper to go pay just a direct cash price instead of using the network that they were provided by the third-party administrator.
Sure. That's awesome. Now, from an employer standpoint, if I understand correctly, and tell me if I got this right, from an employer standpoint, really what you're talking about is direct contracting, right? You cut out the insurance company, you set up a direct contract between the employer and Veritas in order to provide a better service at a lower cost to the employer, right?
That's right. Instead of going through a network at the local hospital, the employer has a guaranteed price with Veritas, and often that price saves the employer so much that they are willing to pay for their employee to travel. So again, with that hernia example, if you're looking at a $15,000 spread between the local hospital and my price, it's worth it for the employer to pay for travel expenses, lodging, and everything else, and pay 100% of the employee's cost rather than pay that higher bill at the local hospital.
Sure. And there are a number of other surgery centers, a growing number across the country that are using that approach when it comes to conversations with employers, right? Places like the Surgery Center of Oklahoma and Texas Free Market Surgery and places like that.
Right. Yeah, there's a growing number of these. The Northwest, part of the reason we started in the Northwest is there's very few options here still. Sure. Keith Smith at the Surgery Center of Oklahoma has probably been doing this the longest of anyone, and has quite a well-developed reputation in the South Central United States. There's options, Smith Medical in Colorado, and Wellbridge in Indianapolis, Solstice in Wisconsin. So there's growing number of places popping up now, but right. There's still often patients have to travel quite a distance to get to some of those locations.
Sure. Now, what I really want to focus on, because you and I have had many conversations about this, but obviously our listeners haven't been in on those conversations, right? What I would really like to focus on is what makes Veritas different than all the other places that you just mentioned. I love how innovative and outside the box your approach is when it comes to dealing with surgeons in particular. And a number of our listeners are are surgeons who just completed their training, or surgeons who are in training, or maybe even medical students who are thinking about becoming surgeons.
Yeah.
And I think they would be very interested in hearing about what separates Veritas from everybody else, because this is the part that got me really excited when you and I talked about this.
Yeah, so basically, when we were looking at getting started, we looked at the Surgery Center of Oklahoma, Wellbridge, surgery centers like that, and wanted to copy their idea. So basically, you have a facility that's completely dedicated to serving cash patients, and then you have a number of surgeons who work at that facility that are either cash only or a mixture of cash and insurance. The problem with that model is that it's very capital intensive. So as a surgeon, if you're wanting to go into this market and get started, you need $5 to $10 million, honestly, to put up a surgery center, hire the staff, get the equipment, and get started, which is a pretty big lift, especially if you don't have guaranteed patient volume yet and you're trying to ramp up that cash market. And the other issue that we realize is there's plenty of good facilities out there. There's literally thousands of ambulatory surgery centers around the country that provide excellent quality care and are willing to do the work at a fair price. And so what we did was we shifted from imagining ourselves as a new surgery center, as a facility, to thinking of ourselves as a physician group. And what that does is it gives us the flexibility to expand more rapidly and also have a variable level of commitment. So I have some surgeons who work full time in the cash market, and then I work with some surgeons who have an insurance practice that is 90% of their clinical work, but then 10% of the time they take patients from Veritas Surgery, and then Veritas functions as their cash practice, but they still don't have to jump ship completely. So for a surgeon who's looking at transitioning, it's a lot easier to say, well, what if I have the insurance practice over here and do part-time in the cash practice, cash world, to make that transition? And because you don't have that huge capital investment in a facility, you have a lot more flexibility that way. We're also less tied to one specific location. And so Veritas actually works in 3 different cities in Idaho right now. We have contracts with 2 surgery centers in northern Idaho, 1 in central Idaho, and a 4th one down in Boise. And so we are able to work with about a dozen surgeons at 4 different locations across the state instead of being tied to one single location.
That's awesome. And so by working at different surgery centers, you don't have to come up with the infrastructure, right?
Right. Basically, all we're doing is we're finding the patient and presenting them to the physician. And then the physician with his office staff sees the patient and operates at them in an existing facility. The facilities are fully certified and inspected. They're have excellent track records and high quality outcomes. So we're letting them do what they're good at, which is running an excellent facility. And the surgeons are doing what they're good at, which is providing top quality care. And then we're simplifying all of the back end billings that the physicians don't have to worry about it. The patient knows exactly what to expect and doesn't have to worry about it. And we end up providing value to everybody so that the surgeon, facility, and patient are all delighted with the outcome and with the relationship that we've put together.
Sure. So let's dig into a few more of the details here. So when it comes to the surgeon, you mentioned that they don't have to spend all that time and hassle on the billing. What about accounts receivable? Like, for your average insurance-based practice, you're looking at anywhere from 45 to 90 days before they get paid whatever it is they're going to get paid, if they get paid. How does that compare to what Veritas does?
Yeah, I mean, I have so many surgeons who are friends who have hundreds of thousands of dollars tied up in accounts receivable, and honestly, they're probably not going to get most of that. For Veritas, we guarantee upfront immediate payment to the surgeon. So as soon as we hear from the surgeon that the surgery was completed as planned, within 1 business day, we send them full payment for the procedure. So essentially 1 day account receivables.
That's awesome.
It's basically
That's
unheard of.
awesome. Yeah, I mean, it's like they brought in a big wad of cash, right?
It's sad that it sounds so revolutionary because in basically any other industry, you're expected to pay when you receive a service, or at most, if you have a contract with a provider. If a plumber works on my house, they'll send me an invoice, but it's got a 1-week payment term or something like that. There's basically no one else that operates on 2 to 3 month payment terms in any other industry.
Right. Exactly. Now, so that's the upside for the physician. What's the upside for the facility?
Yeah, so for the facility, the big advantage is that we're bringing them patients that they wouldn't otherwise get. One of the biggest, uh, One of the biggest economic levers in healthcare today is that hospitals are buying up all of the physician practices. In the last 20 years, we've swung from 80 or 90% independent physicians to almost 80 or 90% employed physicians. And what that does is when you're employed as a physician, the vast majority of your work gets funneled towards your employer. It's illegal for them to tell you that you have to take your cases there or that you can only refer inside the system. But that's just how it ends up happening. The convenience of being in the same location, talking to the same people, all of the referrals for surgery and imaging and testing and everything ends up funneled into your employer. And so that means that those hospitals are capturing the vast majority of the market share. For the independent surgery center, they don't have that control of the situation. And so they're losing all of these cases and patients to the hospitals when often the surgery center is actually clinically a better place to do those procedures. Hospitals are great if you're sick, have chronic medical problems, or doing a high risk procedure. But for the majority of surgeries, an ambulatory surgery center actually gets you back on your feet and functional and back home faster and with better outcomes than the hospital can. And so for the facility, we're helping direct those patients who often would otherwise get referred into the hospital surgeons and have their procedure at the hospital. We're getting them to the surgery center, and we're paying the surgery center a reasonable fee. It's not an incredible fee. So for the surgeons, we usually try to be one of their best payers because the surgeons are at the core of good healthcare. We want the surgeons to be fairly compensated for what they're doing, and that means paying them quite well. For the facility, we're paying them a very reasonable fee on a par with what everybody else is paying them. So it's not that we're paying them better, but we're guaranteeing them new volume that they wouldn't otherwise get. And we're still paying them enough for them to make a profit margin, a reasonable profit margin on the care. So they're happy to have the extra business because it's better for them to be busy than empty with no patients.
Sure. And then obviously you're doing it without all the hassle that they have to deal with when they're getting paid through the insurance company.
Yeah. We pay the surgery centers, we tend to pay a little bit slower just because there's more paperwork there. Often for orthopedic surgeries, we pay implants at invoice cost. So there's a little bit more there. But usually the surgery centers we're paying within 1 to 2 weeks, roughly, still far faster than the same 2 to 3 month payment cycle that they typically expect.
That's so awesome. Okay. So again, playing devil's advocate. So I'm Joe Blow, and I need inguinal hernia surgery, but I live in Kansas. It's great that people in Idaho get this, but, don't you guys have any plans for, reaching out to other parts of the country so I don't have to get on a plane? Are you going to open up somewhere else?
So there's two parts to that. There's the short-term question. There's a lot of surgeries that it's actually quite easy to travel for, especially if you're willing to go 2 to 3 hours away. It doesn't necessarily mean needing to travel all the way to Idaho. Our goal is to at least have multiple locations where patients could fairly easily get to them without having to fly or travel more than half a day. The longer term answer, though, is that the solution, the way we fix healthcare is by having something like this available almost universally across the country. There's two basic approaches to the healthcare conundrum in America right now. You have Walmart and Amazon One on the one extreme with the idea that you need this national level giant corporation. The bigger you can make it, the better. And that economy of scale is going to be the solution to healthcare cost. We're on the very much the other extreme where the solution to healthcare is local. Fundamentally, healthcare is an interaction between one patient and one physician. Everything you add to that just gets in the way of that interaction. Obviously, you have to have some support staff. You have to have an office and everything. But the more layers you start adding in terms of billing and bureaucracy and hospital administration, everything else just gets in the way of that interaction and degrades the quality of care and the experience for the patient and the physician. So ultimately, our vision is direct relationships locally in the patient's own community where you can get anything from primary care to surgery to subspecialist consultation, basically in the community that you live in without having to travel for it.
That's awesome. Now, one of the things you and I had talked about before, and correct me if I'm wrong, the piece that you were most excited about, or at least the potential for a lot of excitement, was what you were hoping to offer sometime in the hopefully not too distant future to people who are in training, to give them, a different off ramp. Can you tell us a little more about that?
Yeah, my goal is to actually be able to hire surgeons full time into this practice model. We're not quite there yet, but the idea is that in training, you spend your entire experience from medical school on in a hospital environment, basically being indoctrinated into the idea that hospitals are the center point of all healthcare delivery, which is they're essential, they're important, but you get this mentality that hospital employment, hospital work environment is basically the only way to do it. And at a minimum, I want to start exposing medical students and residents to the fact that there are options outside that, possibly developing training rotations down the road. But the ultimate goal is going to be to offer full-time employment to surgeons so that they can come straight out and do that. One of the really interesting things that's been developing the last several years, I think partly accelerated by COVID, is the realization that you can do part-time work and that there are different models for practice. It used to be that healthcare was all the lifelong practice in one community for 30 years in the same office. And as we've increasingly moved to the employment model, the hospitals have kind of spelled their own destruction there, because the more you have employed physicians, the more those positions get interchangeable, which means that as a surgeon or as a physician, you're no longer as unique or irreplaceable as you used to be. But the beauty of that is that you now have the flexibility to work part-time for a hospital or to do locums work and start a cash practice on the side. And this is increasingly common with a lot of direct care physicians, either in direct primary care or in direct specialist care, where you can work part-time in both worlds because of the way that the employment model has reshaped things.
Sure. Now tell me this. What is the single biggest objection that you've heard from physicians that you have conversations with who aren't doing direct care, and how do you address that objection?
I think the biggest challenge would be that we're cherry picking the best patients, or the patients that can pay, or that we're providing preferential treatment, that we're providing extra attention to patients who can pay more. And fundamentally, patients are choosing what they want to do, and we're providing the best quality care we can to them. Patients aren't choosing not to have insurance because I'm going to provide them expedited access. Patients are choosing not to have insurance because they simply can't afford it. And then their option is to simply not, as we've discussed, they end up not getting healthcare because they can't afford it. So what I'm doing is providing a way for them to actually still get that healthcare without being bankrupted by the insurance system. So basically, I'm not creating a two-tier system. I'm helping people who aren't even in the system and don't have access to healthcare get access again.
That's awesome. And then for the employer, what have you found to be the single biggest objection that you get from employers who are thinking about direct contracting, and how do you address that?
Yeah. For employers, I think it's a complexity issue. It's great if you are a podiatrist and you go to the employer and say, hey, I can provide foot exams and remove bunions for your employees, and here's my list of prices. The employer may be delighted by that. It may be great prices, but it doesn't fix a real problem for the employer, because the employer also needs somebody who can do hip replacements and fix hernias and do eye exams. They need a comprehensive solution for their employees' healthcare. So what Veritas really offers in terms of that is, when we go to the employer, we can say Veritas can provide fair pricing for almost any surgery that your employees need. With one button, you put Veritas into your health plan, or add a direct contract with Veritas, and now you have access to all of these instead of having to piecemeal go out and find a new surgeon for each individual thing that you need. And that's where that economy of scale or group power comes in for the surgeons to approach an employer.
Awesome. Now, let's say I'm an independent surgeon, and I'm interested in doing something similar to what you guys are doing, or maybe even collaborating with Veritas to bring that, let's say, here to Omaha. What do I need to do on my end in order to make a system like this work?
The single biggest thing is going to be finding a facility to work with. Typically, the facility cost for a surgery cost is about 80 to 90% of the cost. It varies a little bit by specialty, but generally that's where most of the cost is going. It doesn't matter if you as a surgeon want to offer cash prices. If the facility is going to charge a bankrupting bill to the patient, then it's the conversation just isn't even going to get started. So identifying typically it's going to be an independent facility, a surgery center that's locally owned by local physicians, or a community hospital that's not controlled by a large national venture capital firm. That's going to be your best place to start. And then finding somebody in the business office who actually understands a business transaction, basically who's willing to take a fair price for a service rendered and not see it as how do I get the maximum amount of money out of this patient as possible, but how do I provide a consistent, steady service to the community at a fair price. That's going to be the kind of person that you can work closely with. Once you have a facility that you can work with, then it's fairly easy to start at least offering your own cash patients those fair prices. That's the first hurdle. The second hurdle is going to be getting access to the larger market. And that's where working with a group of other surgeons that you're not just offering one single service to those employers or to whoever you're advertising to. The more specialties and more surgeons you can get together, the more attractive that's going to be.
Sure. So then in talking to those facilities, what have you found to be the single biggest, or maybe the most common objection that the facility has when you first introduce this idea, and how do you address that?
So the biggest thing for facilities, especially for a surgery center, is they want to be busy. They have to pay a certain amount to their staff just to exist. So for the facility, what they want to see is that you're bringing them new cases, not just repricing cases they would have already gotten, and that you're going to add to their overall utilization or volume. And one of the most persuasive things there is showing them that as a surgeon, the more that they work with you on the cash patients, the more you'll do of other patients there as well, or just in general that you'll preferentially work with that facility. So for myself, the surgery center that I go to, I do 80 or 90% of my cases there, and so I was quite eager to make time for me to get my cases added on or to be accommodating. If you have a surgeon who's only going to bring 1 or 2 cases a month to a facility, they just have less interest in working with that surgeon or accommodating them. But the more volume you bring, the more interested they are in making sure that you're satisfied and that it keep coming.
Sure. So let's say I'm, ABC widget maker. I'm a self-insured employer and I'm thinking about getting into direct care. What's your advice for an employer like that? Either with respect to Veritas or in the bigger scheme?
Yeah, the biggest thing is just pull the plug and get out of the insurance market. The sooner you do it, the better. There's a lot of different ways to do it. You can go completely self-funded. You can use a third-party administrator like one of the big insurance carriers. Even just doing that will save some. But the more you can go truly self-funded with an independent TPA, the better. If you're completely new to the idea, the best step is to find somebody who can actually help you and guide you through it. There's a lot of different organizations that are actually trying to help their customer and not just make a profit off of them. Healthcare Rosetta is probably the biggest name. Healthcare Rosetta is a group of brokers who approach it as a fiduciary duty to actually help their employers get the best possible care instead of simply making money off of them. The problem is that a lot of health insurance brokers are actually getting more money in kickbacks from the insurance companies and from the pieces that they put into a health plan. And so unless you have somebody who actually is serving you as the customer, serving the business as the customer, and not just seeing you as a tool to get kickbacks from somebody else, then they're not really going to advocate for you and help you set up a cost-effective plan. So fundamentally, finding independent brokers or contractors who will help you put together that plan and using as many independent pieces for it as possible. That's going to be the most cost-effective savings there.
That's awesome. And then let's say we have an orthopedic surgeon, chief resident getting ready to go find something to do after residency. What's your advice for somebody like that who's, in training and looking for a better way?
Yeah, I would say the single most important thing is don't just take the shiniest contract you see. Often hospitals and employers are going to try and lure you in with large signing bonuses or big promises up front. But fundamentally, anytime you're employed by someone else, they control you and they control your practice and your life after that. So even if it means taking a small pay cut, it's better to be independent and have control of your practice than to get a larger paycheck and not have that freedom. It's a couple of ways that can be, you can look for that practically is when you're negotiating a contract. If you're looking at an employee position, insist on being able to do outside work, the freedom to see other patients or to have the flexibility to take patients to a surgery center instead of just to the hospital. Even better would be to avoid full employment jobs and look for independent practices to join. It's getting harder and harder to find truly independent physician groups to join, but the freedom and the quality of life and the independence that you maintain by working as an independent practice instead of for an employer is worth the effort to track that down and the sacrifices that you have to make financially to make that doable.
Sure. Medical students. What's your single biggest piece of advice for medical students who are thinking about, maybe becoming surgeons? If you had to go back and talk to yourself when you were a medical student, what is the one thing that you would tell your younger self that you wish you had known?
Ask more about the business of medicine. Look into the finances. Talk to the doctors that you're rotating with about how their practice runs, what their relationship with their employer is, how their billing works. Learn more about that. It's easy as a medical student to get tunnel vision on the actual, how do I do this physical exam, or what's the most unusual case I saw today. But once you get finished with your training, a huge part of medical practice is the financial side. When you're taking care of a patient, you're taking care of the whole person. You're not just treating one narrow physical problem. You're taking care of their mental health, their social situation, and their finances. And you don't want to fix this problem for the patient while bankrupting them and devastating them on the side. So start from now learning to think of the patient as a complete picture and look at how the system that you're working in, the office that you're practicing in, is affecting the rest of the patient's life and financial health.
Awesome. Any other last words of wisdom you'd like to share with everybody?
I think that's it.
All right. So last question I have for you. How do people find you?
So veritassurgery.com is where all of our patient prices are posted. All of our physicians are visible on there. And we're on social media, TikTok, Instagram, Facebook, all of that as well. Veritas Surgery.
Awesome. Well, thank you, Dr. Abraham, for joining us today. It was exciting having you as our guest. It's always exciting to talk about direct care surgery and direct care medicine in general. Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.